a show that tackles the big issues affecting the BVI and the rest of the Caribbean. Searches for answers to today's big questions and gives viewers a unique perspective on developing stories. Follow the big story with me, Kathy Richards, only on GTV. This show is brought to you by the National Bank of the Virgin Islands, Cyril B. Romney Turtola Pier Park, NV Salon, Nail Spa and Barbershop, Tisley Cross Deliciously Smooth Cider, and Digicel, simply more speed, reliability and entertainment.
Plug into Digicel Plus and get even more entertainment with Disney Plus included. The best of Disney, Pixar, Marvel, Star Wars, and National Geographic all in one place. Whenever you want, plug into Plus to enjoy Disney Plus and much more with a home fiber bundle. Sign up today. Digicel Plus.
This is the big story. I'm Kathy Richards. I want to thank you so much for joining us for this edition. We were set to be out of the woods, but we're not really totally out of the woods, and so we want to be talking about COVID-19. Yes, we're going to be talking COVID-19. My guests today are Dr. June Samuel and the nurse Marina Badu. Want to welcome you to the set. Some say first time.
Thanks for having us, Kathy. It's great to be here on the big story.
Yes, it's a pleasure having you.
Yes.
We know that we have moved from a stage of pandemic with the COVID-19, and we're more in what is said to be an endemic phase.
That's
and,
right.
Yet we know that there are some steps and precautions that we still need to be following. We feel as though that we have a free-for-all now, that you're not mandated to wear masks here and there. Some places you go, they don't even bother to give you hand sanitizers and all of that. So we feel a little, you know, free and can do as we wish and be a little bit of complacent. Why should we still be of concern about COVID-19, Dr. Samuel?
So I think the important thing is maintaining vigilance. And we want persons to maintain vigilance because there are individuals in the community who would be susceptible to COVID-19 infections, especially if persons are older, they're at risk, or they haven't been vaccinated. So the virus is now endemic. Basically, it's circulating in the community out there, and what that means is that you could be exposed and not know it. And when persons are not being as careful as they ought to, then you could easily then transmit that virus to someone who is susceptible. And at the Health Services Authority, we know that we're about care, but we're also about prevention. Okay? And certainly on the hospital side, we continue to see persons who are admitted to hospital, who are incidentally positive, and recently we've had 2 cases where individuals actually were admitted with COVID pneumonia, and these are persons who are older. So it is something that we continue to be concerned about, and so we want to make sure that we make sure persons have it at the front of their minds, okay, about the things that you ought to do to remain safe.
You said incidentally contracted.
Well, incidentally positive. So all persons who come to the hospital for care get tested on admission, and so we may incidentally find that they're COVID positive, but they don't have symptoms of COVID-19.
Okay, so you were still doing that whenever a person comes to access care, you must be tested.
Yes, absolutely. So because remember, within a healthcare facility, we have to make sure that everyone is safe. The persons who are admitted to hospital are considered to be vulnerable. So And then once individuals, if you're admitted to hospital for some other reason than COVID, but if you're COVID positive, then we have to nurse you and take care of you in a particular way.
Okay, since we have moved from pandemic to endemic, have we seen any deaths in the territory? I don't recall seeing any statistics.
Right. So we have had in the community persons who would have died. So you have deaths within the community, and those individuals do get checked as well. But we haven't had any deaths in hospital from individuals who've been COVID positive. No.
Okay. For my sake, and I think our audience would appreciate a little explanation on that, because it was a bit confusing to me throughout the pandemic. Do we test the person after they would have died for COVID-19?
Once a person dies outside of the healthcare facility, before they're admitted to the morgue, yes, they're tested. And the reason for that, again, is about infection control. So bodies that come to the morgue that are COVID positive have to be then placed separately from those that are not.
Did I understand it to be that the virus only lives you could only detect the virus is only alive in a person that is living, and once you're dead, it's
No, you will be able to detect the virus even after death. So, and even during the pandemic, we had several cases where that was the situation. Once you test the person and you run the PCR test, it will let you know whether the person is positive or negative, and how positive or negative.
Okay, thanks. Education never stops.
No, it doesn't.
But 2 years, but yet still.
But it's good for you to make that point, because part of us being relaxed is that we forget that at home we have persons who have chronic diseases, okay, who have illnesses that make them susceptible to COVID-19. So persons who are immunocompromised in any way, whether you have cancer, you're on immunosuppressant drugs, you have chronic diseases, you can't really mount an immune response. This virus out there circulating, those individuals are at risk. And that's why, we have to keep the messaging out there, and the vaccine drive is an important part of helping persons to continue to protect not just themselves, but the persons that you're living with who may be at risk.
And we're saying a lot now is that, we just got to learn to live with COVID.
Oh, yes. And that's a part of living with COVID. Yes.
All right. So we come to vaccination.
Yes.
We know we've had several pushbacks with vaccination drives, but we have had great support as well, because persons would have understood. You might have had a family that, like you said, is immunocompromised in some way, and you want to do your part to make sure that they're safe and even to protect yourself. So we are continuing vaccination drives. Tell me what's planned, Dr. Purdue.
Okay.
I mean, Doctor,
She received it.
Oh, wow.
Yes, Kath. So, in order to try now to relax and to keep the population safe, we want to continue our drive for vaccination against the COVID virus. So we have planned 2 weekends of drive. We had the first weekend, last weekend, the 27th and 28th. And we saw a fair amount of persons coming in to have the first and second booster doses. We continue with the drive on this coming weekend, the 3rd and the 4th. And although the uptake last weekend, we say fair, but we're satisfied, we're happy, because every vaccination shot, COVID vaccine counts. Especially now that we have the mask, we're not seeing any masking, and the social activities are open.
Yes.
Persons have become relaxed. And we will not want to go back into a stage where we would have to be so vigilant again, having to wear masks, hand sanitize. Everywhere you go, you have to be very careful, particular. So we're trying to avoid that, because we realize that vaccines have been very effective during this whole pandemic
Yes.
to get us to the stage here now of the endemic stage. So with all of the vaccines that we were giving, and we know of the upsurge in the COVID last year, in the early part of last year, May, June, July, where we saw so many deaths of our loved ones, close friends. We do not want to go back there again. So we're asking persons outside there, we're begging you, please, in order, as Dr. Samuel said, to protect your elderly persons who are at home, your dearly beloved grandmothers, grandfathers, your aunts, your uncles. You might be very well, the younger people might be saying, oh, we cannot get COVID. But that's not true, because you can have some underlying problem that you're not aware of, and your immune system is not as strong. And so with the going out and the partying, the drinking, you can.
Even being at home with your family.
Yes.
Oh yes, and that's something that has come up. Of some persons have said, "Oh, but my relative was at home. They don't go out anywhere.
Yes.
How can they get it?" Yeah, they may not be going out, but everybody else in the house is going out.
Yeah,
And
you just go to work.
Exactly.
Yeah,
So
yeah.
yeah.
You might just walk out and you say, I'm going to the supermarket. And by the time you get back there, here you are, you say, but my mother did not go anywhere. She was in the house all the time, but she is positive and you are not positive. So there is a problem where you might see somebody looking very healthy, but they carry the virus and can pass it on to the person who is not that very strong, whose immune system needs to be boosted, and so they become infected.
Okay. Dr. Samuel, we always hear whenever reference is made to the social events and the parkings and the clubs, oh, so why are you jumping on the clubs and the other places too?
Yeah, well, I mean, any place where there's a crowd,
church,
right? There is church.
Yes.
You have other events. Schools are about to open, so any place where there are going to be multiple persons gathered in a space that's enclosed, that increases the risk of transmission. It still does. So outdoor gatherings, once you keep your distance, then that's better. But anywhere there's a gathering.
Okay. Where are we doing the drive this time around?
At the lobby of the Dr. Orlando Smith Hospital.
Okay, it's not at the
Yes.
festival ground.
No.
Okay.
Yes. From 9 in the morning until 3 in the afternoon, both Saturday and Sunday. So we were asking persons to come out. Those persons who have not had any vaccine at all, they can also come and start the regime of vaccination. Persons who have had first and second doses, we are asking you to come out and have your first booster and second booster doses, so that you will be complete, even stronger.
First booster and second booster?
Yes.
When did the second
That's
booster
what
part
they
come
refer
in?
to when they refer. I probably must have heard they say we're going for a fourth vaccine, but this is referred to as your second booster. Yes.
So second boosters are available
Yes.
if you so desire, and if you're in the high risk category, and that's one of the recommendations coming forward. So persons who are over 60.
So why are you fighting appointed at nurse?
No, because I want her to make sure I get the age correct. I was going to say 65, but I think it's over 60, yes. And if you have any chronic diseases, any condition where you're immunocompromised, on treatments that can that are immunosuppressants, those groups, it is recommended that you do a second booster.
Vaccines for infants and young children.
We have no vaccines for infants. They should know.
Okay.
The vaccines that we had previously for the pediatric children up to 5 to 11 years of age. At present, we have no pediatric vaccines, so we only have the adult vaccine. We're hoping to get some pediatric vaccine at some point in time in the near future, not too distant one.
Okay.
Yes. However, while I'm at this point, I would like to advise, campaign,
Advocate.
Strongly
advocates,
advocate. Yes.
beg parents and guardians outside there with children. We still continue to have to immunize children with the childhood vaccines. And so the BVI had a history of boasting of a coverage of 98 to 100% coverage in our childhood vaccines. We have seen a great decline in the uptake of the childhood vaccines since the COVID virus started. And we've looked at different reasons why it happened. Initially, we say, okay, parents and guardians are afraid to come out because of the lockdowns that we had, prevented them from coming, the social gathering that we had social distancing, they were not coming to the clinics. And but now that we are in a decline where they have time now to go and do every other thing, they can take their children now to any of the clinics that they are used to have the children vaccinated. And especially now that school will be reopening, the children are required to be vaccinated for entry into school.
Yes.
Remind me, my kids are all adults now, so I'm trying to remember those vaccines.
So we have
MMR.
the vaccine. We start with the diphtheria, tetanus, pertussis, MMR, measles, mumps, rubella, the varicella, which is against the chicken pox, and those are compulsory vaccines. So they need all of those vaccines for entry into school.
Okay.
We have had quite a few persons coming in refusing to have the children vaccinated because of the same COVID vaccines. And so we try now to see how we can get them to please continue the children's immunization at the various clinics.
Okay, awesome. What brands of vaccines do we have available right now?
What brands?
The types, the Pfizer,
You mean for the COVID?
COVID.
Oh,
COVID.
Pfizer.
only Pfizer?
Yes,
Only
Pfizer,
Pfizer.
yes.
Okay,
Yes,
only Pfizer
yes,
we have right
yes.
now.
I also want to draw to your attention, Kathy. So this issue about parents having their children vaccinated, we would be aware and we're mindful that there's now a resurgence of polio, okay, in the US. And there have been outbreaks of measles in the past as well. Now, it's a very international world. People move from one place to the next very easily. So one of the issues is if we let our vaccination coverage fall too low, then we lose the advantage of having the herd immunity. Okay, and we have to maintain that
introduction of the
or else
vaccine of the diseases that we already eradicated to come back again.
Right. So that's something we don't want to have to deal with. Polio re-emerging in the
different
BVI.
places.
Right.
We
so
had 157 children in Africa, and out of those children, I think it was 100 of them, or 57 of them died from the polio.
So
yes.
So it is something that we want, parents to be mindful about. Yes, we know there's all the debate back and forth, but this is a significant issue. It's about the health of the whole population and certainly about the health of the children in the schools.
All right.
And over the years, we have seen the importance and the efficacy of vaccines, what it has caused, because the outcomes where we had the disease that we had polio, we had measles, and we have not seen those cases except now again, and we see those cases emerging, especially in the countries where they are having a lot of problems in getting vaccines.
Okay.
Yes.
Yeah, well, we started off, we were here to talk basically about COVID-19 vaccination,
But we
right?
but
this is so important because, during the time of the pandemic, during the peak, I would say to some people who were very reluctant or had high reserves about being vaccinated for COVID-19, but yes, you picking up the children and rush them to take the other vaccines.
Right.
So you're protecting them in one way, but you refusing
You're
to protect
refusing.
yourself.
Well, that was one of my education when I was talking to parents, and I said, but you are coming to get the COVID vaccine and you're refusing to have your child vaccinated. I started by asking them, first of all, are you vaccinated? Have you got siblings? Are they vaccinated? What went wrong with you as a child to now you're an adult? What went wrong? I said, so is it because the child cannot talk and make a decision on his or her own, you refusing to have the child vaccinated? It is the right of the child to have the child vaccinated, so you protect the child's life and you help build a child's immune system so that they can face whatever is coming against them, especially when they start going out to the daycare centers or the schools where they meet with different children. You don't know what each one carrying.
Yeah.
Yes.
And then we've seen, well, it's the old one, but it's on the
Yes.
rise again.
Yes.
Hand, foot, and mouth.
Yes.
I remember those.
We
growing
know,
up, very uncomfortable. Anyhow, Dr. Samuel and Nurse Badu, take back the credentials.
That's fine.
It was a real pleasure having this discourse with you. Very educational, very informative, and we trust that that people would take the opportunity to be educated and to do what is best for us all.
Thank you.
All right.
Thanks.
I want to thank you for taking that special time to join us here on the Big Story, but to remind you to be at the lobby of the Dr. D. Orlando Smith Hospital this weekend and get your vaccines. If you have not had any dose, you can have your first. If you've had your first, you can get your second, and then the booster, and then the booster. You heard a big shebang, so make it happen so that we can continue to live safe and healthy here in the Virgin Islands. I'm Kathy Richards. I want to thank you so much for joining us for this edition of The Big Story.